Hello everyone, my name is Dr. Cruz, and today we'll be discussing the difference between a good airway, a narrow or a bad airway. So have you seen your airway, and do you know what happens when you have a narrow airway? It can cause many dangerous symptoms, including snoring, high blood pressure, hormonal changes, obstructive sleep apnea, restless sleep, and much more. The way we identify a narrow airway is with a CBCT, which is a three-dimensional X-ray of your head that allows us to see the airway in the back of your throat and nose. As you can see from these two CBCT images, one has a very narrow airway, and the symptoms for this patient are snoring, ADHD, restless sleep, and moderate sleep apnea. Whereas this patient's airway is noticeably bigger as seen in the CBCT image. However, these two patients both have improper muscle and tongue function. While taking the CBCT, the patient is instructed to swallow and bite on their back teeth and relax. Therefore, we can see that the patient's natural resting position of their tongue is on the floor of their mouth rather than the roof of their mouth. We do therapeutic techniques and exercises with the patient in order to train their tongue for the correct tongue position and to help establish lip seal and breathing properly through their nose. Now, in order to correct the narrow airway, we perform a CIF analysis. The CIF analysis tells us how much we can change the patient's teeth, not only orthodontically, but skeletally as well, in order to improve their airway. For instance, how much we can expand their upper and lower jaw and teeth, or bring their arches forward and out of their airway. Now, what if the obstruction is both in the back of the throat and the nose? We provide appliances to be worn at nighttime in order to prevent the tongue and jaw from obstructing the airway if the patient chooses not to go through orthodontic treatment. If deemed necessary, we refer to an ear, nose, and throat doctor to correct the obstruction in their nose via minimally invasive or non-invasive techniques. Here at Millennium Smiles, we take breathing very seriously due to its effect on many underlying dental problems and overall health. We have the most up-to-date technology to identify the airway disorders and treat them. And we are always diligent in our effort to educate our patients in the problems they are facing now and will face in the future if the breathing obstructions are left untreated. We look forward to treating you to a long life of healthy breathing.